You've probably heard the term nurse delegator before, and you might have thought, don't all nurses delegate tasks? Well, you're not wrong, but the nurse delegation profession is quite a bit different than a nurse in a hospital or a clinic setting that's delegating tasks. Our main goal is to make sure that the vulnerable population gets safe, quality care, either in their own home or a setting like their home, and often from people who don't have a nursing license. With nursing shortages growing and more people wanting to age in place, this work is more important than ever. Everything in delegation starts with an assessment. When I walk into a client's home or a potential client's home for the first time, I want to be able to assess them. I want to see what their needs are. I want to see if they're stable and predictable. I'll look at their MAR, I'll look at their medication list, whatever they might be using, whether it's in their own home, an adult family home, or a supported living setting. I'm going to look at whatever they're using to manage their medications. I'm going to look at any blood sugar logs. Do they have dangerous highs or dangerous lows, or is it pretty stable? If they have blood pressure problems, is it often too high or too low? Are there blood pressure parameters on their medications? I'm trying to get a clinical picture of how stable this client is to see if I can safely take them on as a delegated client. I also want to see if they're a fall risk. I want to assess their cognitive status. Are they able to understand why they're taking medications and what they are? Do they know the times that they need to take them? If not, that's okay because we can delegate those tasks and oral medications. But I want to see what their understanding is. Do I need their consent or do I need their guardian's consent? Because delegation requires consent. They have to be informed of the process. They need to agree to the process and be okay with me accessing their medical records and being a part of their care team. Sometimes when I review their medications with them, I will find old prescriptions mixed in with new ones. I'll find duplicates. They might not know what they're taking. They might have multiple medications for the same thing. Before moving on, I like to just go through all their medications with them and make a clear list that we can both agree on and make sure that we're going to move forward on the same page. The next step is training the caregiver. This is where we build trust because the caregiver is the one that's going to be carrying out the task that I'm teaching them, and they're going to be doing so under my license. So if I'm teaching blood sugar, we're going to go step by step. I'm going to walk them through everything. Every glucometer is different, it seems. Every time I walk into a house, there's a different glucometer. So it might take me even a minute to get to know the one that they're using. But what I do is I walk them through it step by step, and then I'll often have them practice on me because I bring my own glucometer, my own test strips, my own lancets, and my own alcohol swabs. So I like to have them walk me through the process to make sure they can teach it back to me safely. And that way the client isn't harmed, the client isn't, irritated that we're practicing on them. Nobody needs to be a pincushion. But I want to make sure that the caregiver actually understands and they can teach me how to do it so that when I'm not there, they know how to safely check blood sugar. That's just one example. If they're delegated for oral medications, I'm going to have them recite to me the 6 rights and why they're so important in giving medication. I also review the instructions that I give because every verbal instruction that I give will also be written down, along with my phone number to text or call me, because I want to make sure that if they're performing a task under my license, that they have confidence they can reach out to me at any time. Then on the instruction sheet, I'm going to show them at the bottom where there's reasons to call me, reasons to call the doctor, or reasons to call 911. Those reasons will be listed out clearly as well as numbers for each person to call. If they need to call me, it's because of this, this, and this reason. Here's my phone number. If they need to call the doctor, here's the client's doctor, here's the doctor's phone number, and here's the reasons why you might need to call the doctor. Then I will also include instructions on when to call 911. These are client specific, but I always include generic reasons like shortness of breath, chest pain, unresponsiveness. If the client is on hospice, the chain of command is often different, so I make sure I include that as well. I need to make sure that they understand the training that I give them and that they can teach it back to me properly. I am legally responsible for the training and education that I provide to the caregiver, but the nurse and the caregiver are each responsible for their own practice, according to Washington regulations. The training process will help build trust between myself and the caregiver. This means that they're going to feel more comfortable when they need to call me. I always try to make sure that they know that they can over-communicate rather than under-communicate. Not only do they need to know how to do the task correctly, they need to understand when something goes wrong. Delegation doesn't stop after caregiver training. I stay involved through ongoing supervision and communication. So very simply put, a nurse delegator, what we do is very important. We try to help this vulnerable population age in place in a home setting or a setting like a home where they can still receive visitors and get to do the things that they love and communicate with others. We help solve nursing shortages while also honoring that deep human desire for independence. It's challenging, it's complex, and it's incredibly important work that is very rewarding. What I've talked about today just barely scratches the surface. There is so much more involved in nurse delegation, but this is just a basic understanding of what we do.